Dr. Urmila, and it's an incredible honor to be in conversation with Professor Vivekanand Jha, Executive Director, George Institute, India, and the current President of International Society of Nephrology. Professor Jha, as we all know, is a recognized global expert on kidney disease, and his focus is on emerging threats globally as well as in India. He actually currently leads in research projects in more than 20 countries. And his major interest is in innovations to address the system and health and economic challenges posed to the humanity because of non-communicable diseases. Has more than 320 publications in peer-reviewed international journals and has authored more than 40 book chapters. He's also a part of various committees like the Task Force and the Scientific Advisory Committee of Department of Science and Technology in India. He is advisor to WHO and is in editorial boards of major international journals. He's also a section editor of the Oxford Textbook of Clinical Nephrology. Welcome, Professor Jha.
Thank you, Urmila, for inviting
Yeah.
me to.
I mean, it's an honor to have you, sir, to have your thoughts today. And as the president of ISN, a few questions to you. But the first one we start is with you. What actually made you choose nephrology?
Well, that's a bit of a long trip back into history because it was a long time ago. I have to say it was a combination of several factors. We had a number of contemporaries who were luminaries in their own right, and many of them have actually gone on to become world leaders, including the current or just the past president of American Society of Nephrology, Anupam, who was my contemporary. And so the presence of these fantastic mentors and colleagues was extremely inspiring. Uh, in nephrology, the opportunity for intellectual stimulation was huge. In our institution, there was always a robust give and take, and discussions were pretty even, and there was no sense of hierarchy. So that's the first point. And the second was the specialty itself, or rather I would say the lack of a specialty, because nephrology didn't seem like a specialty at that time. It was closest to internal medicine and still remains one to this date. And so I even tell today to young medical postgraduates, if you want to remain an internist and if you want to still do some specialization, get into nephrology. It is still the least industrial, least technological specialty. And it also provides other kinds of intellectual stimulation because you get the opportunity to think about physiology, you think about how immunology works and how do you disrupt that in a way that, that is helpful to your patients. And finally, around the time when I was, sort of taking up nephrology was at a critical juncture. So one of the most amazing things I found for myself was the ability to take a patient with end-stage organ failure and to extend their lives. That was possible only in nephrology at that time. And for many low-income and low-middle-income countries, I think kidney failure is the only organ failure in which we can substantially improve the life of the patient. Dialysis was maturing, so during my medicine training, I saw the tail end of keel dialyzers, which were disastrous if you had the experience, and then there was a transition to hollow fiber dialyzer, which immediately changed the way dialysis was delivered. So that sounded very amazing. And transplantation was also coming on its own, with the calcineurin inhibitors becoming just available, and we slowly understanding the immunology more and more. So I think it was a combination of all of these factors that made the choice relatively easy for me, and there was never a doubt that I would be doing nephrology.
Thank you for that answer. Many of us have followed your career, and we have seen you in your checkered work. You went on to become the professor in the same institution where you trained. What were the projects that you would fondly remember during your stay in PGI? And what are your current projects which you think you would like to sort of grow and have some effect on humanity? And if time permits, will you just say a few words about Global Kidney Policy Forum?
So in terms of project, I think it's been an incredible journey for me in terms of research projects. So soon after I finished my nephrology fellowship and I started as a faculty member at PGI, I started a randomized clinical trial. So that was my first commitment. And I'm really pleased that I did that, because that randomized clinical trial ran for almost 15 years and led to a very high quality publication, which contributed to guideline development. So I look back with great deal of satisfaction on that. And that also, I think, inspired a number of other junior colleagues who are continuing to do that kind of work. So that was the randomized control trial in membranous nephropathy that I did. And the critical point in me getting started on that was I was never afraid of taking advice and acting on advice. And I continue to do that even today. So because that was suggested to me by one of my senior colleagues from PGI, Professor Vinod Bansal, who is now in Loyola University, Chicago. Um, and slowly starting out from that, as I interacted more and more with patients, I started getting interested in socioeconomic determinants of health. And what do people's living situation, people's ability to access care, how does that determine disease presentation and behavior? And there again, I was influenced both by my mentor, Dr. Chuk, but also Professor M.K. Mani, who was in Chennai at that time and was starting community-based programs, which directly spoke to the socioeconomic determinants of health. You know, the other thing which I would say, that I'm not afraid of taking ideas from others and walking through open doors when I see one. And that took me into basic science arena, and I went across to US, worked in a basic science lab of Professor Vikas Sukhatme, discovering the pathogenesis of preeclampsia and other things. And so that helped me come back and set up a research lab at PGI. And I realized that one of the biggest challenges that we face as clinicians is that we have made a remarkable progress in discovery research. So in the last several years, we now know how can we treat different health conditions, starting from diabetes, hypertension, kidney disease, kidney failure, etc. But despite having all of that knowledge, there are large proportions of our population still don't get the benefit of that scientific knowledge. So how do you take that scientific knowledge to the people who require and can benefit from it? So it requires you to step out of your comfort zone. You need to become necessarily multidisciplinary. You need to look at these health challenges and their solutions from the point of view of the people who suffer from it, and also from the point of view of people who make these policies that will affect them. So how do you make that change happen? Many of the conditions that we deal with in nephrology are neglected diseases. There is no funding for it. There is hardly any research going on, at least in India. So getting together people who are interested in it and developing networks is something which I have focused on in the last few years. National networks, the Indian Chronic Kidney Disease Network. I'm really very pleased that we were able to set that up. And also hooking that up to international networks through the International Society of Nephrology mechanism, but also other mechanisms that are available to us. And through that, contribute to capacity building in the country. Because I think one of the big challenges that we face, and some of the other senior as well as middle level researchers in nephrology face, is to build the next generation of nephrologist researchers. Because if we don't have them, we don't contribute to the knowledge, existing knowledge or new knowledge. And you know, not doing that also affects the care of patients that we see. I have seen that all the institutions and all the departments that take research seriously also provide high quality patient care. So there is a very direct one-to-one link. And so that's why I would advise all the young upcoming nephrologists to think of at least a part career in research.
What do you think has been the most challenging part of your tenure the last 2 years? And how did you sort of overcome it?
In terms of what has been the most challenging event, that is very easy to answer. And if I just need to say one word. If I said any other word, you'll be surprised. So it is COVID-19, of course. It has shaped the way we live, we work, we think. We have lost a lot, I think, which has been a great tragedy in terms of our colleagues, but in terms of just the general humanity, the humanity has lost. But we have also learned a lot as community. And we have seen the power of resilience, both in the community, general community, and also the healthcare professional community. It's the interesting bit, I wouldn't say challenging, but the interesting bit has been to take care of change management. How do you manage this change? Because it has completely upended almost everything that we did in the past. The first challenge that we had to face as a result of COVID-19 was to take what we thought was an incredibly difficult decision to cancel the World Congress of Nephrology in 2020.
Yeah.
And now, if you look back, you would think that, why would you even think that it was a difficult decision? It was such an easy decision to make, but at that time it was difficult. And what it did for us is to give us an opportunity initially, after we had stopped being shocked and reeling a little bit, to think of how to turn this adversity into an opportunity. And the opportunities could be in the form of education, in the form of knowledge sharing, in the form of shaping the global nature of response to this pandemic, and coordinate how we did things with each other. We realized very soon after the pandemic that there was a great hunger for knowledge in the global kidney health community. So that is how we started our response at the ISN, by putting together these collaborations. So we wrote up the first paper, which was published in Kidney International in March last year, by experience that was gathered through the Chinese Society of Nephrology and the Taiwanese Society of Nephrology on how do you manage dialysis patients during COVID pandemic. And subsequently, through the ISN education platform, online platforms, getting together nephrologists from Italy, who were the first wave of countries that was hit by COVID-19 once it came out of China. So I think an interesting experience there was when we announced the first webinar, the webinar platform crashed because it was just not set up to take as many attendees as logged in. And so we had to actually postpone that webinar and record the session with Dr. Ian Ozella and broadcast it. And subsequently, we augmented the platform. So that was a lesson. And so then that led to a series of events of a mission to support the global kidney health community. So we also developed unique ways of communicating, and the ISN social media team, through their links with other colleagues, were instrumental in spreading the message that was important to kidney health professionals. We know that the social media usage of people has gone up by orders of magnitude during this pandemic. And I have to, I would be remiss if I did not mention the role of ISN volunteer leaders, but also the ISN staff who rose to the challenge. We recognize that suddenly the kind of work that they were doing increased several folds, but they took it up as a challenge and as something that was consistent with the ISN mission and continued to deliver. The ISN leadership, the ISN volunteers, the ISN staff also worked very closely with other national societies, other regional societies, and organized joint sessions. We worked very closely with the World Health Organization. We issued advocacy statements with the American Society of Nephrology, European Renal Association, Latin American Society, African Society or African Association of Nephrology, Asian Pacific Society, and many, many more national societies. There are just too many to name. We also realized the value of advocacy, and we realized that nephrologists, in addition to being clinicians and scientists, they also need to be the most important advocates for their patients. And that advocacy has been needed in a number of places in making sure that they were not discriminated against and disadvantaged when the COVID pandemic led to lockdowns and shortage of supplies and so on, and dialysis patients faced incredible difficulties. To the most recent, when vaccination drive has started, making the point that dialysis patients are the most vulnerable to COVID-19 and should be prioritized for receiving vaccine. So I think all those series, and that work continues, it is not going to stop. All the organs of ISN, not to forget mentioning the ISN journals, the Kidney International and Kidney International reports, have published a series of high quality publications, making sure that they are communicated in a timely manner. There was a pressure to turn the editorial decisions around very quickly, but making sure that it is balanced with quality was always challenging. which the editorial teams have been able to do fantastically well.
Thank you. So this is, during your presidency, this will be the first, I think, virtual World Congress of Nephrology. What are the programs or what are you looking forward to from 15th to 19th April?
You're right that this is the first virtual World Congress of Nephrology. So what am I looking forward to? I'm looking forward to everything. Uh, in a way, this virtual format has freed us up from our traditional way of thinking about congresses, right? Where you are bound by time zones, you are bound by availability of rooms and strict structuring of sessions, etc. So it has given us freedom to innovate. And you will see a number of innovative sessions which will showcase the high quality work that the ISN has done over the last 60 years. We had the opportunity to showcase a number of those ISN, I shouldn't say ISN, the achievements of global nephrology throughout the year in 2020, because that was the 60th year, and some of that will continue in the World Congress as well. The ISN's long history of grant programs has led to remarkable achievements by the recipients of those grants, ISN fellows, ISN sister center awardees. So there will be a number of events that will highlight the achievements of those. There will be a number of interactive sessions, so the scientific sessions will be somewhat different. Uh, and of course, you did mention earlier about the policy forum. So policy forum has become a very important component of the World Congress of Nephrology. The last two events were incredibly successful, and we are very much looking forward to this year's policy forum as well. We are going to hear from the chief scientist of the World Health Organization that has been really at the forefront of the COVID-19 pandemic, and we'll hope to hear directly from her as to how these responses were shaped and what can we hope to see in future. We have Dr. Richard Horton, the dynamic editor of the journal The Lancet, who will chair the policy forum sessions. So we are going to hear from them. And we have, of course, focus on the region, which is North America and Caribbean. We will have contributions from there. And you will hear about outputs from a number of ISN events or ISN initiatives, such as the Global Kidney Health Atlas. And there will be that release of the 12 points of the ISN that form the pledges of the Global Kidney Forum and how it links to the Sustainable Development Goals. So it is once again an opportunity for us to come together as a community and rededicate ourselves to making sure that the global community, not only the kidney health community, but the global health stakeholder community doesn't forget the need to include kidney disease in its responses. The final thing that will happen during this World Congress of Nephrology is the release of dialysis framework. So as part of the engagement with the World Health Organization as an NGO in official relations with WHO, the ISN has carried out a series of activities. And one of those outputs is going to be has been a development of a framework for setting up dialysis facilities in low-income countries. And that is going to be released during this policy forum as well and the World Congress of Nephrology. This dialysis framework is unique in the sense that it is not a prescriptive framework. It lays down a menu of options for setting up dialysis programs, and each country can choose the option that suits its needs and its resources that are available to those countries the best. And it provides them with a path to make incremental progress, to starting from maybe providing some basic dialysis to its population, but slowly increasing the quality and monitoring quality. We have laid stress on quality, we have laid stress on monitoring, we have laid stress on reporting, and we have laid stress on transparent decision-making and making sure that all the stakeholders are appropriately engaged while this treatment framework is delivered. As we do with congresses, the focus will be on knowledge sharing, the focus will be on science, and the focus will be in increasing the opportunity of interaction. So one thing that we are able to do well in physical meetings is the opportunity to interact with our peers, maybe get opportunities to have informal conversations which lead to often very high quality collaborations and research projects. And we are planning to provide a series of such networking opportunities where people can come together and have an opportunity to exchange ideas. Of course, there will be a virtual exhibition, industrial exhibition, and that will also be somewhat innovative, which you will find out.
Professor Jha, thank you very much for your time. It was a wonderful interview, and really, really grateful that you have told us a lot about what to expect during WCN 2021. Thank you very much.
Thank you, Urmila.
Thank you, sir. Thank you very much, sir. This was wonderful, sir.